The following video features multiple perspectives and layered 3D audio to give you a closer, more tingly experience. If you enjoy it, please subscribe to help small creators keep creating. Thanks. So, why don't we start with some overall general health questions, okay? Just try and answer them as honestly as possible. It doesn't matter if, don't know, but it's just a rough estimate, okay? So, how would you rate your overall health for the past 6 months?
Quite good, yeah.
Pretty good. So, on a scale of 0 to 5?
Maybe 3.
3, okay. Any health issues bothering you?
I have a knee problem, but it's an old injury.
When did you do that?
Oh, years ago.
Years ago. And it still bothers you now?
Every now and again, yeah.
Okay, but not majorly.
No.
That's alright then. Your diet, how well do you eat? So, 0 being terribly, 5 being perfect.
Maybe a 3.
Okay, that's fine. I don't think anybody is a 5 on that. Okay. And your sleep, do you sleep well?
The majority of the time, yeah.
And rough estimate of hours per night?
6 to 8.
That's good. Wake up at any point?
Not as a rule, no.
6 to 8. And the quality of the sleep, so 0 being just awful, 5 being sleep through the night perfect.
Maybe a 4.
Good. So no real issues there.
No.
That's your physical side. Let's move on to your mental health. If you have any issues there, have you been diagnosed with anything?
A minor anxiety disorder.
Is that triggered by anything?
Just stresses.
Yeah, just normal life stresses. Life can be stressful. And are you receiving medication for that?
No.
That's okay. And the impact of that mental health issue, the anxiety, is it kind of 5 being it takes over your life, 0 being it's not a problem at all?
Maybe a 2.
Okay, 2, that's good. Lastly, just a little bit about your family. Any sort of standout medical issues there?
Not really, no.
Okay.
We're quite healthy people.
Alright, so I'm going to check over your face and your sensation in your face. Just going to pop on some gloves for this. Give you a little bit of instructions. All you need to do is close your eyes and answer the questions. Don't mind touching your hair, do you?
No.
Good. Not everybody is fine with that. There we go. Alright. Alright, firstly, I'm just going to ask you to close your eyes, and I'm just going to look over your scalp and your face and press slightly about the area, and you just let me know if you feel any discomfort, any soreness. Any prior head injuries?
No.
That's very good. So, thank you. Just pausing your hair, looking at your scalp, which looks to be in good condition. Don't see any lesions there. Or cuts, scrapes. And you just let me know if, when I press on an area, it's if there's any pain or irritation, okay? Okay, that's good. Just gonna move your hair out of the way. I'm just gonna press around your scalp. You just let me know if it feels the same on both sides, okay? Here and here.
A bit softer on the left.
Okay. Here and here.
Yeah, that's right.
Okay. And here. They might not be perfectly the same, but that's fine. Here, here.
Yeah.
Here, here.
A bit softer.
Here and here.
Yeah.
Good. Here, here.
A little bit softer on this side.
Okay. Here, here.
Yeah,
Here, here.
Yeah.
Okay. Just gonna move on to your face. I'll really try and protect your makeup as best I can. Any soreness in your temples?
No.
Do you get any headaches?
I get migraines.
Oh, you do? Okay. Is that like light triggered or?
Dehydration normally.
Okay. Well, obviously, you need to drink more water. I think we all need to drink more water, to be fair. And just feeling around your neck, just clench your jaw together. Very good. Over here. Just gonna check your lymph nodes now. Don't seem to be swollen, which is good. Just gonna lightly press around your orbital bone. That's this area. No soreness?
No.
Okay. Okay, a couple of instructions now. They might seem a bit silly, but just raise your eyebrows up and squish them down. That's very good. And relax. And just scrunch your nose. Very good. And puff your cheeks out. Suck them in. Very good. And just relax. Okay. Seems to be good. Feel good?
Yeah.
Okay. Alright. Just on the sensation point. So I've got an object here. This is the sharp end. This is the blunt end. I'm going to just press lightly at various points over your face, and you just tell me if it's the sharp or blunt side, okay? And obviously eyes closed, no cheating. So just for reference, this is the sharp, and this is the blunt. Okay. Here.
Sharp. Blunt. Sharp.
Yes.
Sharp. Blunt.
Good.
Sharp.
Very good.
Sharp.
Very good.
Blunt. I'm not sure.
That was blunt. Yeah.
Sharp.
Yeah. Yeah.
Sharp.
Yeah.
Sharp. Blunt. Blunt. Blunt.
Very good. Go ahead and open your eyes. If you could just turn and look that way and close your eyes, I'm just going to come a little bit closer and look into your ears and your skin, okay? Okay. We have a look. Just put your head down slightly. That's good. And that way slightly. I'm just gonna have a look into your ear. See anything? Look nice and clean. See any blockages? Good. And no excessive buildup of wax. That's fantastic. Good. Let's check it out here. The ears look nice and clean. No blockages as far as I can see. Any issues with your hearing?
No.
That's good. Your skin looks nice and healthy. Lovely. If you just look the opposite way. And I'm going to do the same here with the magnifying glass and light. So I'm just going to move your head back. Just properly over your shoulder. Thank you. Perfect. Lovely. Just going to look at your ears. Okay. So move your head. Nice and clean. No blockages as far as I can tell. Lovely. Okay. Can I take these off now? Do you clean your ears?
Yeah.
Q-tip, just water.
Yeah.
If you use a Q-tip, it tends to push stuff in, so generally not advisable. Okay. So I'm just going to write a little bit of this down. So we just use scalp. There was no issues there. Is clean. No blockages. Clean. Good. Alright, that's that done. Okay. I'm just going to check your lungs now.
Okay.
And your breathing. Do you smoke?
I do.
That's a problem.
Yeah.
Keep one eye open just so I can hear you. If I could just ask you to hold on the top of your top. Thank you very much. I'm just going to press here, and if you could just breathe really nice and slowly and relaxed. Try not to, try not to breathe too quickly. Deep breath in. Hold it. And let it out. Just over this side. Keep breathing like that, that's good. And let it out. Very good. Here, and again. And out. And lastly, just down here. In. And let it out. Alright, now we just need to do the back if we could. Alright, so we're just going to do the same on the back now. Just going to press at various points and deep breath in. Okay, I'm giving you a little cough. And let it out. Alright, just keep breathing in that rhythm. Just hold it for a second or two and let it out. Okay. And again. And let it out. Good. And over here. And let it out. You're doing very well. And again. And out. Just going to do on the bottom. Here. Little cough. And same over here. And same over here. Good. Do I hear any issues there? Right. Okay, well, your breathing sounds good. Your lungs sound nice and unobstructed. Any colds or like COVID in the past 6 months?
Not in the 6 months, but I did have COVID.
Did it affect your breathing at all?
Yeah.
You probably don't need me to tell you, but the smoking is like not going to help that. I would definitely recommend you quit if you can. Alright, I'm going to check your pulse now. Just need to make sure that you are alive. I'm going to do this by timing a minute and holding at various points. I'm going to do one here and then on your wrist, okay? Again, just close your eyes and breathe nice and slowly and try and relax if you can. Any like elevated stress will give you a false high reading, so there we go. Alright, and now I'm going to time a minute and count, okay? That was 30 times that by 2. Any rest in particular?
Either or.
Go for this one. This one's always a little bit hard to find. Somewhere around here. There we go. Same again, ready? And just breathe nice and relaxed. Very good. It's nice and healthy. It's about 68, 67. Go to the gym after that day.
Climb mountains.
Yeah. That boy then. Good resting heart rate. I'm sure it'll be even lower if you didn't smoke. Not to harp it at all. How about we look in your eyes? Do you wear glasses?
I don't, no.
Okay. Contacts, anything like that?
No, nothing.
Okay. Don't mind a reasonably bright light being shone in your eyes too.
No, it's fine.
Okay. Little paddle, just going to ask you to cover one eye. Okay. And see light here? Okay, just follow it only using your eyes. Don't move your head, don't look up and down, okay? Just move back a little bit. See here? Ready? And go. Very good, your tracking was pretty spot on. Very, very good. And switch. See light? Good. Just follow it only using your eyes. And here. Very, very good. Okay, lovely. You can take the paddle off. Just need you to make a little dividing line with your hand between your eyes. Pick point somewhere over this direction. I am going to shine quite a bright flashlight into your eye, and I'm going to swing it between the two, and I'm going to check the consensual and direct response. This just means that this eye is dilating and this one dilates too, even though the light is going into this one.
Okay.
So pick a point anywhere in that direction. Very good. I'm going to start with your left eye, which dilates very nicely. Just going to check the consensual and direct response in your eyes. Your left consensual looks good. Good. Just on this side. Just going to check the direct response over this side. Keep looking somewhere over there. Very good. And the consensual response looks spot on. Just going to check the direct. And consensual. Very, very good. Sorry, this is the closest light in your eye. Right, I'm going to ask you to look similar over there, and then I'm going to come in quite close, and I'm going to basically ask you to look in some directions, okay?
Okay.
You can have it covered with your eye or a paddle. That's fine. Just focus that. Looking over there. Sorry, you just have to come quite close now. This is just looking at the back of your eye. Alright, you could just look up and down to your right and left, back to the center and down and left and down and right. The middle and look directly at the light. Good. Just blink. Okay?
Yeah.
Just turn this way a little bit so I can get to this eye. Again, just looking somewhere over there, okay? Just gonna focus in. Okay. Just gonna put my hand in here so you can feel how far close I am. Just gonna boff you on the head. You just look up and look down to your left and to your right. Okay. Back of your eyes look nice and healthy. I don't see any redness in the blood vessels. Okay, look up. And down. Just gonna lift up your eyelids, just keep looking down. And to the left. To the right. And back to the middle. And then look directly at the light. Okay, look up and left. Up and right. Down and left. Down and right. Good. Blink a few times just to get reacclimatize with the room. Back of your eyes look very healthy. Lovely. Just gonna quickly check over your muscles now. Don't worry, you don't need to be like shrug your shoulders up and don't really push them down. Very, very good. And now push your arms out, don't let me push them in. And then the opposite. So pull them in, don't let me push them out. Very, very good. Hold your hands like this. Okay. Just pull your fingers out. Very, very good. Now this hand, push back on mine. Good. And this one. Very, very good. I'm just going to pull them out, just pull them together. Very, very good. Flip your hands over. I'm just going to push down, you push up. Good. And same on this side. Very, very good. Everybody likes those. Just going to knock on the back of your elbows and then your knees just to check your reflex is working. Just going to find the right spot. On this side. Just on the back of your hair. Go in on this side. And on the front. There. So it wasn't too hard, was it? It seems you're very healthy. Your nose in your head, in your face, all that is working perfectly. It's fantastic. Aside from the smoking and possibly the sleep, I would say clean bill of health. And I would check in about 6 months for another one.
Yeah, correct.
Lovely. Okay, well, I'll see you then.
Yeah, thank you
very much for coming.